A therapist in Leeds recorded a 50-minute session with a dead man. Dr. Eleanor Voss, clinical psychologist. Tuesday, the 3rd of December, 2013. 3 o'clock appointment. Long-term patient. David Moran, 58. Grief counselling. His wife had died the previous year. David arrived at 2:40, signed in at reception, sat in the waiting room. At 3:02, Dr. Voss opened her door and called his name. She conducted a 50-minute session. Her notes described David as more settled than recent weeks. Reflective. They discussed acceptance. He mentioned wanting to visit his wife's grave. The session ended at 3:52. When they checked the therapy office, the chair David had sat in was still warm. At 4:15, the receptionist entered the waiting room to tidy up. David Moran was still in his chair. He was dead. The coroner estimated he had died between 2:45 and 2:55, before the session started. For 50 minutes, a dead man sat in the waiting room, and a dead man sat in the therapy chair. The same man. Dr. Voss records every session. She played the 3 o'clock recording. Her voice is there. Asking questions, responding. David's voice is there too, speaking clearly. For 50 minutes. 2 voices. One of them belonged to a man who was already dead in another room. Nobody has explained how that recording exists. Dr. Voss retired in 2015. She never discussed it publicly, but the audio file was archived with her clinical records as required by professional standards. In 2019, her successor was reviewing archived files. He played the session. He confirmed 2 distinct voices. He also noticed something Dr. Voss hadn't mentioned. At the 47-minute mark, David's voice pauses mid-sentence. 3 seconds of silence. Then he says, very quietly, "I think I'm already there." Dr. Voss responds, "Already where?" The recording ends. The file is intact. It simply stops. There are no further sessions.